Hello everyone, welcome to NG's Corner for Nurses. Today in this video, we will discuss the concept of burn and the types and degrees of burn injury. This video will cover the definition of burn, review of anatomy and physiology of the skin, types of burn injuries, and the classification or degrees of burn injury. We can say a burn is an injury to the tissues of the body which can be caused by heat or chemicals or electric current or radiation. And the resulting effects of burn are influenced by the temperature of the burning agent, duration of contact time, and type of tissue that is injured. Next, coming to the layers of skin. First is epidermis, an outermost layer that contains the primary protective structure. It is the superficial avascular layer of stratified squamous epithelium. It is ectodermal in origin and gives rise to the appendages of the skin, namely hair, nails, sweat glands and sebaceous glands. Next is dermis. Dermis is a vascular layer of the skin derived from mesoderm. It is made up of connective tissue with variable elastic fibers. The connective tissue is arranged into a superficial papillary layer and a deep reticular layer. It supports and strengthens the epidermis. Next is hypodermis. It is a subcutaneous layer of fat beneath the dermis that supplies nutrients to the other two layers and that cushions and insulates the body. Next, coming to the functions of skin. First is sensation. We all know skin acts as a sensory organ. Next is protection. It gives protection to our body from mechanical injuries. And the third one is regulation of body temperature. Next, coming to the types of burn. In types of burn, first is thermal burns. Thermal burns caused by flame, flash, scalds. Scalds is the spillage of hot liquids or contact with hot objects are the most common type of burn injury. The severity of the injury depends on the temperature of the burning agent and the duration of contact time. And this type of burns generally occur while cooking, smoking or burning something or using hot oils. In thermal burns, there is also a cold thermal burn. Cold burns, also called frostbite. Cold burns cause damage the skin by freezing it. Persons can get frostbite by being outside in freezing temperatures, or it can also happen while the skin comes into direct contact with something very cold for a prolonged period of time. Next is chemical burn. Chemical burn are the result of contact with acids, alkalis and organic compounds. Next is electrical burn. Electrical burns are the result from intense heat generated from an electric current, direct damage to the nerves and blood vessels. Next, coming to the inhalation burn or inhalation injury. This is also known as smoke injury. This is occur from breathing of hot air or noxious chemicals. That is inhalation of hot air or noxious chemicals, and it can damage the respiratory tract. Next is radiation injury. Radiation burns are the sunburn is a type of radiation burn. Other sources of radiation like X-rays or radiation therapy to treat cancer can also cause this. Next, coming to the classification of burn injuries. We can classify the burn injury in two ways. First way is according to the depth of burn injury, and the second way is according to the severity of burn injury. At first, according to the depth of burn injury, we can divide the injury in four types. That is first degree, second degree, third degree and fourth degree. And the second degree can be further divided into two types, superficial and deep. And on the other hand, according to the severity of burn injury, we can divide the injury in three types, minor, moderate and major. Let's discuss the classifications according to depth of burn injury. First degree or superficial burn injury. It involves only the epidermis. It is red, painful and tender, blanches under pressure and possibly swelling is present but no blisters are there, and it generally heals in 5 to 10 days without scarring. Next is second degree or partial thickness burn injury. The second degree can be divided into the superficial and deep burn. First is second degree superficial burn. It extends through epidermis into dermis. It is red, moist and shiny, painful. Blisters may be present. Heal in approximately 14 days with variable amount of scarring, and wound is extremely sensitive to temperature changes, exposure to air and light touch. Next is second degree deep burn. The burn may appear mottled with pink, red or waxy white areas exhibiting blisters and edema formation. Sweat gland and hair follicles remains intact. Healing time may be extended beyond 14 days with extensive scarring. Next, coming to third degree or full thickness burn injury. It involves entire epidermis and dermis and extends into subcutaneous tissue. Nerve endings, sweat glands and hair follicles are destroyed. Varies in color from red to tan, waxy white, brown or black, and a leathery appearance. It is painless. Wounds are not capable of reepithelialization and require surgical excision and grafting. And the last one is the fourth degree burn. It is a full thickness injuries that involves underlying structures such as muscle, fascia and bone. The wound appears dull and dry, and ligaments, tendons and bone may be exposed. Next, coming to the classifications according to severity of burn. First is minor burns. It includes 10% of body surface area burnt with first and second degree burn. Next is moderate burns. It includes 10 to 20% of total body surface area burnt with second degree burns, and 2 to 5% of total body surface area burnt and third degree burn but not involving eyes, ears, face, genitals, hands, feet or circumferential burn. Next, major burns. It includes 20% or more total body surface area burnt and second degree burn. All third degree burns greater than 10% of total body surface area burnt. All burns involving eyes, ears, face, genitals, hands and feet. And the complicated burn, that is the burn associated with trauma, fracture, head injury, cancer, diabetes mellitus, pulmonary diseases and all the at-risk patients. If this video is useful for you, then please Put a like and share it with others. And for getting more videos like this, you can subscribe my YouTube channel or follow my Facebook page NG's Corner for Nurses. And for any queries or suggestions, you are most welcome to comment. Thank you for listening.